Hi and welcome to Federal Bank Let's Talk. Today we are at the Kerala Institute of Medical Sciences, one of Asia's leading tertiary care hospitals. It is a landmark destination that provides world-class healthcare services. Today we have with us the Chairman and Managing Director of KIMS, Dr.M.I. SAHADULLA. Let's talk. How was this idea conceived, the setting up of a hospital on this scale with the state-of-the-art technology, infrastructure and super specialities?
The idea came up pretty accidentally, if I can say so. I was outside for about 28-30 years.
Okay.
After my education and some service in Kerala State, I went out to UK and then later on to surgery. And then I decided to come back because I always had my roots in Kerala. So when I decided to come back, I really wanted to start something here. Fairly decently with the experience I have gained outside. And so that it will be good for the people and I can give some service. So when that idea came in, it was on a very small scale. I thought I will make a 100-bed hospital and with my friends and just give a good service in internal medicine because I am an internist. And as the idea grew up and more friends joined together, they said, no, there is room for a multi-speciality hospital of quality. And why don't you try that?
What are some of the facilities that KIMS is proud of?
Yeah, this is a question I often think about myself and also difficult to answer. I should say that it is the quality, patient safety and transparency which has driven us to an amount of success so far. If I talk about one department, then the other departments are going to come and say I didn't mention about that. Having said that, we want to have excellence in most of the multi-speciality departments. Every hospital will have similar departments, I am fully aware of it. However, how different you can be in rendering the service. And this is what I usually call it as healthcare delivery. See, the facilities can be there in plenty. Money can buy anything these days. You can also have the equipments and you can have good doctors. But you have to merge all these things to the satisfaction of the stakeholder. And the most important stakeholder is our patients.
In this era where technology reigns supreme, how do you think the doctor-patient relationship has changed? Are we losing out on the human touch?
Unfortunately, you are correct to a great extent. And we try here not to lose that. When the equipment come, the habit of touching the patient. I always tell my doctors and colleagues and also the students, please touch the patient. And that touch has a curative effect. That is becoming less and less. When I walk into the wards and I see that the doctor's hands are in their pockets, I really feel bad because that's the hands he has to put around the shoulder of the patient and pat on him. So that you are quite right that to some extent it is coming down. But I think we may have to see, we always take examples from outside. United Kingdom was a classical example of clinical examination, interpersonal relationship, and later on they also started deteriorating. They are also in the equipment, but US has kept up a combination, a good combination. Today, before they do the test of MRI, CT or anything else, they have to examine the patient and they have to document a series of things before they ask. Unfortunately, we do not insist on that, or rather we do not really follow that order, and that is where the interpersonal relationship is going away. We try to inculcate, and in this hospital I should say that we definitely maintain a reasonable relationship, and I feel doctors should more and more understand that interpersonal relationship is much above any equipment or any technology in the world.
So what is the role that KIMS has played in promoting medical tourism in the state?
Medical tourism has grown over the years, in the last several years, and we cater now about 37,000 patients per year. Okay. And a good half of them could be Maldivians, and then we get a lot of Arabs, Africans, and also the Caucasians from various European countries. Okay. The mechanism grew just because we were harping on the quality quite a bit. And how did the world know that there is an organization here? We had done some marketing, and the executive director of our hospital, Mr. Najib, is also the chairman of a good travel organization, and they also have promoted through various channels they have nationally and internationally. However, the best marketing is always happens by
word of mouth.
Some agency nationally, like Indian NABH or Australian accreditation we had, and in several areas, and this also being a very effective tool. So our names is in the embassies. What is accredited hospitals in India? There are only a very few. So our names are in the embassies, in the various catalogs and things like that, and so that also has played a good role.
What is your take on the recommendations of the Balraman committee, and if implemented, how will it affect the running of your hospital?
Okay, it's a good question. It's very contemporary. Nursing is unfortunately have not received all their rights. But the approach which the Nursing Association as well as the government have taken are not the ideal ones, I would say. I always talk in all the meetings that nurses should be respected. They should have much better self-esteem. They should be better treated by doctors. In Kerala at least, or in India in general, they are just subservient. And that attitude should go. They should be part of the care. When I go in the morning to take rounds, the person who is talking to me about the patient first should be the nurse. Then government has come out with a minimum wage, and that minimum wage the government has to see that every institution in Kerala follows that. And unfortunately, it is not an easy process. It's a painful process. See, now the nurses are heard only because they have made an association and a big strike noise and strike and everything. It should not be like that. They should have a nursing director, who can represent their causes. They should have, like a DHS, there should be an important person in the nursing at that level who can speak for them. So there should be a nursing hierarchy. Now, coming to Balram Commission, I think slowly and steadily, no hospital will be objecting to go into that. But when you open it suddenly, there will be a lot of financial impact. And one has to understand, towards the end of the day, there is an investment component in every hospital. and there is a very important manpower component. Okay, so they have to be happy, and for the customer to be happy, and the investors also have to be happy, because they do expect something, at least not a loss. Okay, so when this equation comes, what happens is that if you keep on increasing one, it will reflect the others, and what is going to happen is that we as patients, see, we are all becoming as stakeholders of healthcare. We may have to pay more, so they don't realize. That's one aspect. And the second aspect, unfortunately, is that nurses are not the only patient care providers. Healthcare providers, there are lab technicians, there are radiology technicians, there are physiotherapists. All of them come in that category, but they are minority, whereas nurses are majority. Nobody is upholding the causes of these people. So where are they going to go? So government should not look at it in a piecemeal. And if they are sincere about it, if they want to learn about it, they should have a much more radical approach in studying and solving their problem. I told the other day in a nursing meeting, ask them to select me as a leader, and I will show how their self-esteem and their remuneration will increase.
My father is a very honest man. That makes him successful.
In fact, I would like to see that we open up a college where international way of teaching of nurses should come into action. Expansion mainly in Kerala, and also probably in some of the states in South India. You have to learn by your own hard work.